Hello, how are you all everybody? Welcome to another episode of Borak Sempoi dengan Dr. Kiru. Today we have a very special guest. He was my former boss in Taiping Hospital way back then. He's none other than Dr. Pandian Ram, consultant obstetrician, laparoscopic gynae surgeon as well, and a fertility specialist. Very renowned specialist not only in Malaysia but also in Indonesia. So Dr. Ram, welcome.
Good to see you, Kiru.
Good to see you after a long time as well.
Yep.
So welcome. Good having you on my podcast.
My pleasure.
Thank you so much.
Pleasure is mine. Yeah.
Okay. So, Dr. Pandian, how are you feeling today?
Good. Always energetic. Okay. Nice to see you. Nice to see the boys.
Okay. Thank you for joining us in this podcast.
Yes.
I think a lot of your patients as well as our followers as well and patients as well, they know us from our background, in our work that we do day to day.
Yep.
But I think topmost of everyone's minds now is why did you choose reproductive medicine and why gynae?
Oh, that's a long story actually.
Yeah.
In medical school actually I wanted to be a cardiologist.
Wow.
Okay. Totally two different things, right?
Yeah, correct.
Yeah, two different things, and in fact, housemanship itself, I bought the cardiostat.
Wow.
To inspire myself to be a cardiologist.
Okay.
But unfortunately, things turned when I joined as a houseman in Taiping Hospital.
Yep.
So first posting was medical. So a lot of things happened which made me to felt very uncomfortable in the department. So then we moved to surgical department. Next posting was surgery. It was good actually.
Right.
Under Mr. Lu.
Oh, okay.
And it was good. Then my last posting was ONG.
Okay.
So housemanship 4 months.
Yep.
Yeah. So 2 months was I was doing housemanship, and we had very short of MOs that time.
Right.
So the boss was Dr. Jaya, Dr. Araku, and the MOs were very nice.
Yeah.
So the last 2 months they promoted me as our MO.
Yeah.
So that made me to then with delivering babies and all that really gave you some nice feeling.
Yeah.
Then you also could do some surgical work which I picked up. So then that's how my interest started in ONG, from cardiology to become ONG.
Fantastic. Yeah, totally out of the blue. A total pivot from a different direction.
Exactly.
But do you think there's a like a challenge being a male gynecologist? Is there any difference in that aspect?
Not at all. Not at all.
Yeah.
And I think I mean to be no offense men, but I guess more women are comfortable with male gynecologists.
Yes,
they feel male gynecologists are more passionate when they work, and also more considerate. Then again, nothing, no harm meant for the female or gynecologists.
Correct.
So I guess all are same. Everyone is same. End of the day, we give the best to the patients.
I think you hit the nail on the head. I think it's not the gender that's important.
Exactly.
It's how we treat our patients and how they feel.
Exactly.
And as long as we make it comfortable, I think it's a very ubiquitous relationship that we have with them.
Yes, of course.
Very important thing, because I know in gynae there's so many specialties as well. But why fertility?
Okay. Out of all my friends in ONG, none of them chose fertility.
Oh wow.
Yeah. None of them. I was the only guy. You know why? As much as you want to make someone, assist them to help them to get pregnant, especially in IVF, when they fail, you have to face that.
Oh, yeah.
You have to break the bad news to them.
Correct.
So not everybody are willing to know how to break the bad news and be, as much as we are happy with the good news, we also must be able to take the pressure off and console the patients who have failed. So that not many people. It's not that they can't do it, but it's a lot of pressure.
Yeah.
A lot of pressure, and I really liked it. So I
think it's true, because when you're helping these couples, attain a goal which they are set. I think we all know when you have a child, both of us are parents as well. It's such a joy in your life,
Yes.
And I think helping them, I think it impacts you personally on a level every single day.
Yes. Yeah. When you look at them, they are not patients. That's why I always tell my patients, when they come to see me, they are not patients. Actually, they're a healthy couple coming to conceive. So it's totally two different things. you as a surgeon, you see patients with problems.
Correct.
So you try to settle.
Yeah.
So when they come to me, they ask, doctor, what to do? I said, the ball is in your court, not my court. I will explain natural pregnancies, this is the success rate, IUI means this one, IVF. So we do all the basic investigation, then we come to a solution, what we want to do. So we work together. So that's why all our patients, they are like our family.
I see that also, the relationship that you have with your patients also, it's really something that's a blessing.
Exactly. So the more you do the work, you feel comfortable and satisfying.
Okay, excellent. Coming to fertility problem, Dr. Pandian, we know that's becoming more common in Malaysia and Southeast Asia as well. But what is the problem that is probably giving the rise of infertility among our patients or among people nowadays?
Yeah, according to the research by LPPKN, the fertility rate a couple of years ago it was about 5%. Now in 2020, it's almost 15 to 20% in Malaysia.
That's really high.
It's really going up. Really going up. Well, probably one thing is late marriage. Everybody wants to settle down first. Be it the male or the female, they like to settle down first before they think of getting married. So by the time they get married, it's about 33, 34, 35. So by the time they try naturally, and when they don't, by the time they come to us, they are almost like 38, 39.
My God,
Okay. It's totally different. So that's one of the main factor affecting you.
Okay. When we say about fertility issues, we always think about the women, that they are, this one. But I think there's a male cause as well.
Definitely. I mean, whenever, for example, when a patient comes to me for consultation, let's say only the lady comes, I will politely decline. I say your husband also must be here. Because infertility issues not only related to the lady. As most of us, we think that, not most, maybe some may think that the problem is only the wife, not the guy. And still we have some egoistic husbands. I mean, they don't want to come with the wife. Some, not many. Mostly they will come. There are some they don't come. So usually when the wife comes, I always tell them politely, please bring your husband. Then only we talk about the management. So it is 50. What I'm trying to say is it is 50-50. It can be male or it can be female.
So I think it's right lah. It takes two to tango.
Exactly.
So you can't expect one person in to have the brunt or the main part of the issue in conceiving. So I think it's very good. The take-home message is that if it's something that has to be done together, and you need a good coach to get the success rate going on as well. Okay. But even then, Dr. Pandian, there's some healthy couples also, even they struggle to conceive, right? So what would be your advice to them? When should they actually start approaching a fertility specialist?
Well, let's say once you get married and start trying to conceive, probably once, after a year, you're still struggling. I think it's about time you should go and see a fertility specialist. And many they don't know who is a fertility specialist.
That's true. That's true.
I mean, again, not to talk bad about other doctors or anything, but it's good if you, even if you don't see a fertility specialist, at least go and see a gynecologist. They can do the workup first. Then probably they will send to us. Or if you can, there are so many fertility specialists now. So they will know exactly what to be done. So you will get a proper advice and the proper management plan. That's good.
Okay, is there an age limit or not, Dr. Pandian, that beyond this you will not touch them or you will not embark in a fertility journey?
It's actually very good question actually. So for me, there's no age limit.
Fantastic.
When we were working in different hospitals, fertility hospitals, the most important thing normally we look at is the fertility rate. Well, how is your success rate? The younger the patient you treat, higher the success rate. The older the patient you treat, our success rate drops. For instance, above 40 or we do a AMH, anti-Mullerian hormone. We'll check to see how much is your ovarian reserve. So let's say the ovarian reserve is very less or below the normal. So most of the time, like we try not to encourage them, and we will politely tell them it's not going to happen. It's like that. There are some doing like that. So that perception totally changed when I treated one patient with a very low AMH, and she failed actually 7 or 8 times she failed IVF.
Wow, that's really
failed,
sad,
and she just came to me and she said I saw her in Semarang actually. Many years ago, almost 10 years ago. So she said she wanted to come and try, and do the IVF with me. So I said, what am I going to offer when she's already tried 8 times? She has seen all the top guys, no?
Yeah,
So then she said, never mind, after my talk, she's just say, wanted to. So when I tried, we tried and we stimulated her. Guess what? We got 1 follicle.
Wow.
From 1 follicle, we got 1 egg.
My God.
Then with that, we transferred and she got pregnant.
Oh,
that's that
amazing.
changed my perception at all.
Yeah.
So whether a person wants to conceive or not, it's not in my hand or any doctor's hand.
Yeah.
It comes from top.
Yeah.
Yeah, it comes from top. We are just playing a part. So just because you're more than 40 or just because your ovarian reserve is low or your sperm condition is not good, I can't say, well, you're not able to conceive. So that perception totally changed me 10 years ago.
Yeah.
So to answer your question, anybody comes, they want to conceive, I will tell them the consequences.
Yeah.
Yeah. Above 40, there are a lot of morbidities and the higher chance of getting Down syndrome and all that.
And all, yes,
so they should understand. So once they understand everything, so once they understand, they are okay with that. And there are so many technologies where we can do to detect these kind of things. No.
Yeah.
So as long as they are fine, we go ahead.
Yeah.
And guess what? My youngest IVF patient is 22 years old.
Oh wow, really?
Again, that answers your question. That age doesn't matter.
Yeah.
People will think I must be 35 or 40, then only I come for IVF.
Correct,
No.
yeah.
She got married at 20, 2 years she waited, she couldn't conceive. Then she said, a lot of pressure from the in-laws, your side, friends, wherever you go, why you not conceiving? 22 again. Yeah. So she came, so we did it. She conceived.
Actually, you're right, Lara. When you say it that way, it's about getting the success rate higher and having a coach to get you to your goal, basically.
Yes. So there's no age limit.
Okay.
So as long as you're ready, you come. That's
Okay.
it. Yeah.
In terms of obesity, because I manage obesity.
Of course.
Obesity rate in Southeast Asia, Malaysia is one of
Especially
the highest.
in our country, yes.
Do you think that because of obesity is one factor that affects fertility?
Definitely, agree with you. Yeah. Definitely, obesity. Of course, there's one thing that also very sensitive issue.
Yeah.
When you talk about our women, obesity and the BMI and all that. No? But you have to tell them in a right way, so they will understand. They will understand. So of course, when a woman is obese, well, the menses are not regular.
Correct.
When the menses are not regular, you are not going to ovulate. Yeah. So when you don't ovulate, chances of pregnancy is very, very less.
Okay.
Not only that, so when you're trying to conceive, the implantation rate is very, 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 very low in an obese woman.
Correct.
And also, if you get pregnant, there is a higher chance of miscarriages.
Correct.
And managing the pregnancy in obesity also difficult for us to scan.
Oh, yeah.
To see the baby and all is very difficult.
Correct.
And then the other issues comes like GDM, diabetic in pregnancy, hypertension in pregnancy.
Yeah.
Then you see, what I always tell my patient is, as much as you want to conceive, I must make sure your pregnancy is safe. That's very important. So just don't jump and go into pregnancy, you want to conceive and all that. You must have a good BMI and good body weight in order to have a safe pregnancy, so that by helping us, you are helping yourself.
Correct.
So that's very, very important.
Yeah, I think you're right, Dr. Mani, because even like when I got married and all that, we never had any of this information class. Nowadays there's antenatal classes and so on, right?
Yes.
Where you educate parents to be about the proper way of carrying a pregnancy, how to take care of your health and classes. I think that is totally different nowadays, lah.
Exactly.
We don't go blindly into getting
true
partners, getting them pregnant, approaching pregnancy alone.
Correct. So let's say another way of is, most of the patients when they come to me after the first consultation, what they tell me, doctor, you are the only doctor never told me anything about my weight or obese.
Okay.
Most of the doctors, we go there, they will say you are overweight lah, you are fat, you need to reduce your weight, you reduce your weight and come, then only we are going to treat something like that.
Yes.
So I don't do that. It's a very big sensitive thing.
Okay.
So when they come, I tell them these are the management. We start. It goes concurrently. Especially for IVF patients. So I start the treatment. We retrieve the eggs.
Okay.
We get the embryos. Then once they get the embryos, they have the confidence. You got the baby.
Right. Correct.
Now I tell them you're going to lose your weight and come.
Right.
Before I transfer the embryo.
Right.
Yeah.
Okay.
So I had a lady who was 135 kilos.
My God. Okay.
She went everywhere. Then they said you need to reduce it. It's not easy to reduce weight.
Okay.
It's not easy.
Right.
So you can't just tell the woman you just go and reduce weight and come. No, not at all. It's not going to work.
Okay.
So you are just demotivating them from getting pregnant.
Right.
So I did IVF. We got the embryos. Then I told her, now you're going to reduce your weight and come. I'm not going to waste your embryos. When I'm going to put in, your pregnancy is not going to become safe. Whether you're getting pregnant or not, that's another issue.
Yes. Correct.
Yeah, because of the obesity.
Correct.
I told her, you reduce your weight and come. We will wait in 6 months' time. I'll see you.
Yeah. And then improves the chances of fertility. Okay.
So she came back in 6 months' time, almost 80 kilos. She reduced.
Right. That's good.
Yes, and she told me, a lot of her relatives and friends started asking her, do you have any disease or whether you have diabetes or something like that. So she said, doctor, because of you, people are thinking that I'm having some disease or something. Correct. So she came, then we transferred. Pregnancy was successful.
Actually, what you said is true. A lot of people, when they lose weight, their friends or thing will tell them, hey, why your face is so
thin? Suddenly you become thin.
I got cancer or what? I think it's a concern, but in the long run, of course, because of the multiple problems associated with obesity,
correct.
For your health, there's something that's worth looking into.
Definitely, yes.
Another thing, Dr. Pandian, I think, was it last month or late last month or early last month, I'm not sure, but there was a change in the name from polycystic ovarian syndrome to polyendocrine metabolic syndrome.
Yes.
So it's a name shift, but for our viewers out there who know about PCOS, they always tell them difficulty to conceive because of that. So what has this name change got to do with anything?
Well, don't get confused with the name change, simple as that.
Okay.
It's a term. It's a term by the endocrinologists or the ONG specialists or consultants, where they want to define the disease more like it's an endocrine issue, something like that. Something like that. But trust me, those women who come to conceive with PCOS, I always tell them it's a blessing in disguise. People think that PCOS cannot conceive, but most of my successful patients are PCO patients. Wow. So if you are PCOS, it's a blessing in disguise. So they think it's a disease.
Correct.
Actually, it's not a disease. It's a genetic condition which is genetically inherited from your mother or great-great-grandmother to yourself.
I see.
So there's no treatment for PCOS. A lot of people think there's a treatment. They go on online, they buy some drugs and eat and do all that. No, you can't treat PCOS. But you can treat the symptoms.
Right.
Let's say you have irregular menses, you can treat the irregular menses. You have hirsutism, hair growth, you can do something about it.
Correct.
And if you are obese, then we can do something about that. And if you are not able to pregnant, we are there to help you. So it's a syndrome of multiple issues.
Dr. Pandian is a very good pickleball player. Plus, he's a very avid sportsman. I know him running from way back 20 over years already. What lifestyle change, Dr. Pandian, would you recommend to women who have PMS or PCOS?
So, you see, for me is how I portray myself to others is very important.
Yes.
Very important. First impression is very, very important. That's how I feel. So when the patient comes to my clinic, when they see my clinic, they say, wow. So when they see the doctor, the way the doctor treats the patient, they say, wow. It's like, I want to come back to the clinic again.
Yes.
It's something like that. Something like that. No. When people, I'm very active in social media, just like you. So you can use social media to in a good way. Or different people use different way. Let's not talk about it.
That's true.
So like you and me. So when people see me in social media, all they see is how healthy the doctor is. I run. Yes. They know that I go for biking.
Correct.
So I travel a lot. At the same time, I do my work. So it's what do you call that? It's a complete balanced life. So when they look at me like that, so what I'm trying to say is, you try to be like me. I'm not saying that you must travel a lot. No, not like that. Not like that. What I mean is, eat healthy food and do more exercise. Be healthy. So, to answer your question, the more healthier you are, the better.
Exactly. That's good, because you're living as an example for your patients as well as for the people who follow you as well. Dr. Pandian, this concept that many women who assume that painful periods is like normal, like when we associate problems associated with endometriosis and so on, right? So if they have painful menses and they've been suffering for a long period, when should they come and see you actually?
Okay, this has been there for a long time, So especially when I talk to my patients, they say I'm having pain doctor during menses, very painful and all that. So do you take any medication? No, I tahan aja. I just control like that. Why? Because my mother said I had also, I didn't do anything. So when I control, why can't you? So my grandmother also said the same thing. So lack of knowledge.
Correct.
So painful menses means it's equivalent to endometriosis.
Correct.
Yes. So you should understand and say it's a gynecological condition where it should be treated and addressed the earlier stage. It creates the environment. I would say an unhealthy environment internally.
Yeah.
You may think you are young, but endometriosis is some of your own blood, your menses, it backflows and it just compromises the entire reproductive system, ovaries, the tubes, and so for example, when the house is dirty, how are you going to live in it? Simple as that. So when the uterus and the ovaries or everything having not a good environment, it's very difficult to conceive.
Correct. So I think that's the reason why endometriosis can affect fertility as well.
Definitely,
right?
That's one of the main reasons. PCOS is good because PCOS, they have irregular menses. Some of them, they have irregular menses, but they have very good ovarian reserve.
Right.
Whereas in endometriosis, the quality and the quantity of the egg becomes very, very less. So that makes life miserable for us to make them conceive.
Pandian, I remember way back in typing also, you were an excellent, you still are a laparoscopic surgeon. So what advantages does laparoscopic surgery offer to women, especially in terms of the recovery or minimally invasive surgery and so on?
Okay, you can't diagnose endometriosis by scan. Okay, endometriosis is a microscopic endometrial tissue which is embedded, placed in everywhere outside the uterus. Unless it becomes a cyst in the ovary, then you can scan. You find that's a cyst.
You can find it there.
The echogenicity and the size. I mean the way the cyst looks, then you know it's endometriosis and all. But unless you have that, you won't know whether the patient got endometriosis or not. Only thing is you have symptoms. Like painful menses, dysmenorrhea, or heavy menses, prolonged heavy menses. So when you have this, then of course you need to go to the doctor, gynecologist, and you ask how laparoscopy is going to help. So I said endometriosis can't be diagnosed by scan. So when we put the laparoscope inside the abdominal cavity, then we will know endometriosis. So basically, if let's say it's a stage 1 where only some spots are there, we can just laser and bus and do dichotomy to do that, clear all that. If there is a cyst, we remove the cyst. So normally endometriotic cysts or endometriosis patients, normally what I do is we do the treatment surgery, then we give injections or tablets for 6 months, no menses. Once they have menses, straight away IVF.
So the good bottom line is that there is treatment available for every condition that is diagnosed well. So you need to see the right person to get the right diagnosis.
Of course,
Okay, coming to the next point, Dr. Pandian. Many couples, they feel very intimidated by IVF. They actually don't know, or maybe now they have access to your social media and all that, they can find out and see. But can you just briefly tell us what actually happens in the process?
True, what you're saying is true. When I started many years ago, we hardly see patients coming for IVF. But now more and more as people get to know, like through social media, and people are more knowledgeable, they read about a lot of things, and over the years many people started coming. So the more knowledgeable they are good actually. It's like I told you, the fertility is a teamwork. So normally when the patient comes to me, the first consultation usually takes about 45 minutes to 1 hour, one patient.
Quite long also.
Yes, quite long. You need to bring them through the reproductive organs and types of the treatment, what investigations we are doing, and what is IVF and all that. So to answer your question, IVF, basically once the person gets mens, as much as IVF is important, pre-IVF is very important. Preparation is very important. Like you say, like they are obese, reduce a bit of weight, proper exercise and healthy food and supplements. I believe a lot in supplements. So you can't simply take out with the sperm what you have and the egg they have, put it inside, create a baby. So we need to improve the quality. So give some supplements to them. I believe in acupuncture as well. Yes, acupuncture actually improves the blood circulation to your reproductive organ. So your uterus, ovaries becomes very much healthy. So the quantity and the quality of the eggs becomes good. Same goes for the sperm. I tell both the couple to go at least once a week or twice a week. That's very, very important. Then comes once you prepare, then only we go for IVF. Once they are ready, then we go for IVF. We plan. So once they have menses, from day 2 we start the injections. So depending on the age, depending on the ovarian reserve, so the dosage we calculate. So we start the injections. So probably 2 injections or 3 injections every day. Minimum 10 days. Minimum 10 days. Depending on the age and the ovarian reserve, it can go up to 12 days, 13 days, 14 days.
Okay.
Then we do a follicular scan to look at the follicle to become big or not.
Right.
And when we talk about follicle, a lot of patients, when they go and see a doctor, when they try to conceive naturally, when they take the tablet, so when they scan, they think it's an egg. It's not an egg.
Oh.
It's a follicle.
Right,
but
right.
sometimes the specialists or the doctors, they tell it's an egg.
Okay.
Just to make life simpler.
Right.
So, but it's misunderstood.
Yeah.
So they think when there is egg, why can't I conceive?
Right.
So what we do is follicular scan.
Right.
So you can see a follicle, but when you ovulate, there may or may not be an egg.
Oh, I see.
It could be empty follicles.
Right.
So in IVF, so of the 10 days time, every third day they come for a scan. So we see the follicles. Once the follicle becomes big, that means at least 17 millimeter.
Okay.
So anything more than the 18, 20, it's fine.
Okay.
So once 17, then we give the trigger that to ovulate.
Okay.
Trigger dose. 36 hours time, we take out the eggs. And the anesthesia, we take out the eggs.
Okay.
Yeah. Then of course we take the egg, we put the sperm inside, make the embryo. Then we do a PGT, pre-implantation genetic testing, to choose genetically good embryo, so that to avoid genetic conditions like Down syndrome and all that.
Yeah.
We freeze the embryo, then prepare the mother for another 2 months. Then we do the embryo transfer.
Okay. All right. Dr. Pandian, for those couples who feel like they want to do it naturally, they just don't want this. I have patients who refer to me for weight loss also.
Yeah.
I suggest to them medication, bariatric surgery, but they will tell me, no, doctor, I just want to do it naturally.
Yeah.
So, is there a big difference between babies conceived naturally and via IVF?
Yeah. First, patients or couples should understand the success rate. Yeah. When you talk about natural cycle, the chances of conceiving is 1 in 10. That means if 10 couple comes, only 1 patient conceive.
Oh.
Or nil.
Right.
Because it's all by luck. What we do is we give medication for the follicles to grow.
Yeah.
We scan. Then once the follicle is big, we give injections for the follicles to ovulate.
Yeah.
Then we just tell them this is the best time for you to be together.
Right. Okay.
But we don't know what's happening inside. We don't know the egg is there or not.
Yeah.
If egg is there, we don't know the egg is good quality or not. We don't know the sperm is going and entering the egg or not.
Wow.
Whether the chromosomes are shared well, whether the embryo, the baby is genetically normal or not. It has to come back and implant. There are so many things, so we can't predict anything. That's why out of 10 patients, maybe 1. Then we talk about IUI, intrauterine insemination, where people think it's a big thing. No, not at all. For the last 10 years, maybe 1 or 2 patients conceive.
Wow.
IUI.
Okay.
Again, what you're doing, you're giving medication, make the follicles to grow. You're giving injections to ovulate. Instead of husband and wife being together, the husband bring the sperm to us. We process the sperm and we inject into the uterus.
I see.
Then our hands are tied. We don't know what's happening.
Yeah.
When we talk about IVF, whatever we cannot do in the first 2 things, process, we can achieve. So if 10 patient comes, out of 10, 8 or 9 conceive.
That's fantastic.
With actually, what we are doing is we are just playing around with the medical technologies.
Yeah.
The more medical technology you use, the higher the success rate.
I think, yeah.
And many people don't know there are many types of IVF. You got fresh transfer, we got frozen transfer, we have frozen transfer with PGTA, you got frozen transfer PGTA with ERA. So when you do a fresh transfer, that means you do IVF once you take out the egg, once the embryo is formed, immediately we transfer. Success is only 20 to 30%.
Right.
Because we don't know the quality of the embryo. The woman is not well prepared.
Correct.
The body is full of hormones. The chance of implantation is very, very low.
Yeah.
Then people start doing frozen embryo transfer. We freeze the embryo, then wait for the lady to recover and prepare the lady for 2 months time, then we transfer.
Right.
Chance went up for 40% like that. But the best is you do a genetic testing before we freeze the embryo. That's called PGTA.
Okay.
I do PGTA for all my patients. I'm a strong believer of PGTA. When you do a PGTA, you know the baby is genetically good or not.
Okay.
So when the baby is genetically good, your success rate goes up to almost 60%.
Right.
Then you don't have miscarriages.
Yeah.
You don't have abnormal babies.
Yeah.
So chances of IVF is good.
Basically, there's some genetic deformity or something like that.
Yes, all avoided.
Yeah,
yes.
I think it's God's natural way of just
correct. Yeah. Then now with ERA is endometrial receptivity analysis.
Right.
We take the sample of uterus, then we send it to Japan. They'll analyze. Then they will tell us when is the time and day to transfer the uterine receptivity. So with that, the chances goes up to 80 to 90%.
Okay. Thank you, Dr. Pandian.
And you were asking about the babies.
The babies themselves, yeah.
Both babies they are healthy. Whether you do conceive naturally or IVF, they are fine. They are perfectly fine.
Okay. That's good to know. Okay, we are at our myth busting segment. where I just ask you rapid fire questions.
Go ahead.
And your answer is true
Fire
or
me.
false. Maybe one line just to answer.
Fine.
Okay, true or false?
Yeah.
So Dr. Pandian, birth control causes infertility. Birth control pills causes infertility.
No, not at all.
Okay. IVF guarantees pregnancy.
Not at all. Never. We never guarantee a pregnancy.
Okay. Only women are responsible for infertility.
Not at all.
Okay, that one I think you answered this. Painful periods are normal.
Not at all. Again, it's a wrong concept. Yeah.
You can always get pregnant whenever you're ready.
Not at all. Again, it's not true.
Okay, stress alone causes infertility.
No. There are many other factors comes in. Yeah.
Okay, so now when we're talking about your story of going into fertility, I'm sure there are lots of downs even with the ups, sometimes.
Yeah.
So Dr. Pandian, what keeps you motivated after all these years and having to tell the couple the bad news whenever it doesn't, it was not successful?
There's a pros and cons of being a fertility consultant.
Yeah.
So as much as you want to assist or help patients to get pregnant and make them happy, when they fail, you must face them. You must face them and explain to them why it failed, and you have to be part of them.
Okay.
Yeah, they have spent so much of money, effort, and time to come to you. They trust you to conceive, and fertility treatment is not cheap.
Yes.
Yeah,
right.
so not everybody are affordable to do IVF and all that.
Right.
So as much as you want to help them, and you must be ready. So most of the obgyn doctors, maybe they go to other fields like laparoscopy or urogynae or fetal-maternal and gynae-onco, where it's more exciting and doing surgeries and all. No, fertility more like engaging with patients. Even though you do laparoscopy work and everything, it's like being a part of the patient and to help them to conceive. That's very much. So when we help them, when we make the patient to help them to conceive, the feeling is very, very. It's what I would say, no words to say. It's the pleasure we get when they bring back the kids. That's why whenever I post in my social media, I always say, welcome home.
Wow.
Welcome home. This is your home.
This is where you
are. Welcome home. So it's like a family. It's like a family. So like every year when I have a Deepavali open house, I call all my patients with their babies.
Very good.
So it's like a big family get together and all that. It makes you like you are part of another family.
Correct.
That feeling is really awesome. As much as that, when the patient fails, so you got to be with the patient. You have to counsel them, tell them that's not the end of the world, and failure is always a stepping stone for success. But it's very difficult for them to accept and move on. But your courage, and I'm not saying that I'm the best or every IVF doctors are best. We also fail. We also fail. That's why if you have noticed, I never said it's 100%.
Yes.
Yeah. So with medical technology, it goes up to, we can bring it up to 80%, something like that. But we still fail. We still fail. So, of course, the happiness and the pleasure in the patient and the way you help them to conceive, that makes you going. That makes you going, and you know that you can help many people out there. So that's something that makes you going. Even though you fail and you fall down here and there and you get up and you walk again. So you never walk alone. That's why in my clinic there will be a big thing. You never walk alone. You always walk with the doctor you have.
I like that. I'll come to that in a while. You touched on something very important about the cost. I think the cost of fertility treatment is exponentially going up.
Yes.
What's your advice for couples out there?
Well, it is expensive, but our government has given some subsidy, something like that, since COVID. I don't know, many people are not aware of this, our KWSP or EPF. So you can withdraw, but you have to pay first, do the process. Then we give a supporting letter. Then you keep all our invoices and all that. Then you go to the KWSP and it can be claimable within a week or two. They are very good, very fast. You can wait until the whole process finishes, then you claim. Or like me, first I do the IVF, retrieve the eggs, then we freeze so they can go and claim. Then when you do the embryo transfer, they can come after transfer, they can claim back again. So you can claim as well partial. So you can claim from your wife's account or husband's account. You can divide.
Good, because you can use both sides as well.
And some banks, they give installment basis also. Like I'm public bank, if you do IVF in my clinic, if you have a public bank credit card, it's an interest-free installment.
Okay.
Not
fantastic.
everybody gives it. It's an
Right,
interest-free installment if you have a public bank account.
Okay.
Yeah.
Okay.
So we, of course, then in between, like if Chinese New Year, your Hari Raya or Deepavali or Christmas, we give promotions. So we give discounts and all that. I think many IVF clinic also they do that.
You have to keep your eyes out and
Yeah.
speak to your fertility doctor and
Yes.
discuss the options that are available.
Correct. Yeah.
Okay, I think we've ended the serious discussion, Dr. Pandian. Now we'll come to what's happening around us right now. I think since the World Cup is going on,
Yeah.
and since both of us are die-hard Liverpool fans,
Yeah.
you'll never walk alone. I'm sure you're watching the World Cup now.
Yes.
Which country are you supporting, Dr. Pandian?
Well, as you know, we like Liverpool and most of our English players and all that. So of course, naturally it goes to England.
Wow.
Yeah. But of
It's
course,
coming home.
yeah, it's supposed to come home. But yeah. So, but of course, we have other teams as well.
Yeah.
So even though I support England, I like any whichever teams which play good game.
Yeah.
For instance, Germany or Argentina, or for that matter, Japan, Korea, they're
Yes.
playing very fantastic games.
Fantastic,
So
yeah.
that I'll just watch. Just watch.
Yeah.
There's no, of course, inner me. I like England. If England wins, it's good. But end of the day, the best team wins.
Correct. That's
Yeah.
true.
Yeah.
I think since you're supporting England all the way, I give you maybe top three. Which countries do you think will lift the cup this time?
Oh,
So England is one of them for sure. Okay.
yeah.
Not
Probably like Argentina, Brazil,
Okay.
and Germany. Yeah.
Okay. Since you've been a very big Liverpool fan, okay. Unfortunately, being champions last year and now, unfortunately,
Heartbroken.
Heartbroken. But we are not out. I think there was some coaching problem, so maybe we got that sorted out.
Yeah, I mean they bought all the old players. Where I mean they were sold off, and when the new players come in, it's human. We are humans. It takes some time for them to combine and play together. So it will take some time, but we have very good players.
Yeah.
All the Liverpool players are performing very well in World Cup.
Exactly. That's why a lot of good things to look forward to. With that, Dr. Pandian, I'd like to thank you for being on our podcast today.
Pleasure is mine.
Really was an honor to have you here with us.
Yeah.
Final parting words lah.
Yeah.
If you have a message to share with the couples who would like to, embark in the journey of pregnancy, what will be the message that you want to share with them?
Well, the first thing is don't feel bad or sad that you're not able to conceive, because as I was telling to Kiru, you people are not patients. You are healthy people trying to conceive. So let's not put the blame on the husband, or let's put not the blame on the wife. And you must understand what are the chances. So you must know, if trying to conceive naturally, what are the chances, and when you don't conceive, don't get upset or don't get depressed that you don't conceive, because chances are very slim when you're trying to conceive naturally. Then IUI is there. So you must plan properly. I mean, let's say you are planning for IVF, straight away go for IVF. Let's say you're not well prepared, try to go naturally. Try to save some money as you move on. So this is what I always advise my patient: try to save some money in case if you conceive naturally. Today there was one Chinese couple who came last month, married for 5 years. So I gave them all the options. Then they wanted to conceive via IVF, but they are quite young couple, no? So I told them, why don't you, because she just came on day 2 of menses or something like that. I told, just try naturally first. Guess what? She conceived. Today she came.
I think it's your words or what?
Yeah, she conceived. They were so happy they conceived. So some are lucky. Some are lucky, they conceive naturally very fast. But some, as you go, so when you don't conceive, don't get depressed. You just move on, go to the next step, save some money. So if on the way you get conceived, use that money for your baby. So if you don't conceive via natural or IUI, then at least you have some money for IVF. Keep an open mind and always talk to your fertility doctors, and always don't think that you are alone. You are not alone. We are there. You don't walk alone. We always walk alone with us. Okay, good luck, and of course, everyone. End of the day, if you really see a good fertility doctor and get a good treatment, chances are always there. If you don't try, you'll never know.
Well, with that final words, I'd like to thank everybody for joining us in today's session of Borak Sempoi, and look forward to catching up in the next episode. Thank you. All the best. Good luck. Enjoy the World Cup.